This part 2 of anti-epileptic drugs, we are going to study the individual drugs and the 5 mechanisms by which they act. The first mechanism which we studied was sodium channel blockade property. So the first class is sodium channel blockers. Now the mnemonic for this is PCB toll. Here PNC stands for our favorite anti-epileptic drugs, the drugs which we know. That is, P stands for phenytoin, C stands for carbamazepine. V stands for victory. No, it does not stand for victory. V here means valproate. Valproate, which indicates victory. Valproate is king of all anti-epileptic. He's like, I'm the best. Because why? Because valproate is a broad spectrum anti-epileptic. कुछ भी कोई भी सीज़ है, we can give valproate. कुछ भी कुछ हुआ, ये हुआ तो valproate. So valproate is, in my opinion, valproate is the king of anti-epileptic drugs. Then the remaining are TOLL. TO stands for topiramate. The first L stands for lamotrigine. Lamotrigine is the second king of anti-epileptic drugs. Lamotrigine is valproate ka chota bhai sort of. It is also a very broad spectrum anti-epileptic. We can give all cases of valproate can also be treated with lamotrigine as well. The second L does not stand for levetiracetam. It's important. Students often confuse between the second L. The second L does not stand for levetiracetam. It stands for lacosamide and other similar drugs like lacosamide, zonisamide, and rufinamide. These are special class of drugs. Now these lacosamide, zonisamide, rufinamide, they also block CRMP2 protein, which is MCQ, but it's not that important. You can just forget this right now. It's not very important. So we are done with first class of drugs. PCB toll, phenytoin, carbamazepine, which are purely sodium channel blockers. V stands for valproate, T stands for topiramate, L stands for lamotrigine. The second L stands for lacosamide, zonisamide, and rufinamide. Okay, we're done with the first class. Now the second class of drugs is potassium channel opener. I told you the anti-epileptic drugs act by opening the potassium channel, not by closing. So potassium channel blocker is not an anti-epileptic drug, while potassium channel opener is. The only drug in this class is cute little ezogabine. Ezogabine. Looks like a Gujarati. Ezogabine, like a kokilabine. There's a drug called ezogabine. We shouldn't forget this, since we often are going to confuse between this gabine because it has GABA in its name. We'll forget because we'll see. So the only drug in this class is ezogabine. The third class of drug is the potassium channel blocker. Now, they block which kind of potassium channel? Here I have highlighted it for you. It's the T type of calcium channel. T type of calcium channel is present in brain. The drug includes a VELZC. The mnemonic is VELZC. Now, what is V? Sabka baap valproate. L is lamotrigine. Now, what's important here that E stands for ethosuximide. They often ask you, okay, what is the drug of choice for absence seizures? And the answer is undoubtedly ethosuximide. How does ethosuximide act? It's by blocking T type of calcium channels. And ZC stands for zonisamide and C stands for clonazepam. So we are done with three categories. Z stands for zonisamide, C stands for clonazepam. Now this is where the confusion starts. Fourth class and fifth class. Now drugs acting on GABA. I told you before key. What we need to do is increase the level of GABA, which is the inhibitory neurotransmitter in brain. Now we can do this by three mechanisms. We can increase the level of GABA by three mechanisms. First is by itself increasing the level of GABA by causing its release, which is done by two drugs. Drugs which increase the level of GABA by causing increased release are pregabalin and gabapentin. You can see in their name that they have GABA in their name, so you can know that they are related to GABA. And IN stands for increasing release. That's how I used to remember. Drugs which increase the level of GABA by increasing release is pregabalin and gabapentin. Pregabalin more than gabapentin. If you're given the choice between these two, prefer pregabalin over gabapentin. The second class of drug in this, which increases level of GABA by inhibiting reuptake of GABA. And how do they inhibit the reuptake? By inhibiting the transporter of GABA. The only drug in this class is tigabane. It sounds very similar to ezogabine here. Now tigabane, we can remember this by using T. T stands for transporter, I stands for inhibitor. Transporter, inhibitor of GABA. So you can remember in such a way. This is transporter, inhibitor of GABA, which increases level of GABA by inhibiting transporter of GABA, which increases level of GABA. Third mechanism is by inhibiting the degradation of GABA by inhibiting the transaminase which degrades GABA. Now GABA is an amine. It's an amine, and so this is degraded by a transaminase. So we can inhibit this transaminase. The drugs which act by this mechanism is vigabatrin. You can remember this by again GABA, TAN transaminase, and inhibitor. Vigabatrin. This is a very special drug. This is used for what? Used for infantile spasms. And the second drug in this class is our favorite, valproate. Never forget valproate. So we're done with drugs which act on GABA, and the last category is glutamate. What do you want to do? We want to reduce the level of glutamate. Now first we have a drug which inhibits the release of glutamate, which is a favorite. People often confuse it. It is levetiracetam. So the mechanism of action of levetiracetam is by inhibiting the release of inhibiting the release of glutamate. And levetiracetam is also known to have a nootropic effect. Nootropic means memory enhancing effect. The second mechanism is by blocking the glutamate receptors. I never understood what is glutamate exactly. I'll tell you. Glutamate receptors are actually sodium channel receptors. They're sodium channels which increase conductance of sodium channel across the cell membrane. Glutamate act as the ligand. So when glutamate comes and binds to this receptor, it causes increased conductance of sodium channel across the membrane, causing depolarization. So we have the second mechanism is by blocking on the glutamate receptors, which are actually sodium channels. Now there are three drugs here. First is the NMDA antagonist, second is AMP antagonist, and the third one is AMP and kinase antagonist. You have to remember these. I'll tell you a way to remember. The first NMDA antagonist we are going to remember is NMDA antagonist felbamate. FELBAMAT. Felbamate. It's a very toxic drug. It's a usual last resort drug for familial syndrome, epilepsy syndromes like that. The second is AMP antagonist. You can remember this because the drug is perampanel, and in between you have AMP. So AMP antagonist. And the combination, the last one is AMPA and kinase antagonist. The two drugs are topiramate and phenobarbital. We're done. This was tough.